Good morning and welcome to our demo games presentation. We are excited to introduce you to MyVitals, our solution to bridge the gap between personal health devices and electronic health records. Here is our agenda for today. First, we'll see why now is the perfect time for MyVitals. We go on to describe the MyVitals solution and how it works. Next, Alberto will explain how to turn MyVitals into a successful business. He will also outline the target audience for this solution and depict our ideal customer. Finally, Luis will show you the implemented solution in action as it is now being deployed at the first customer sites. Let's start with the market opportunity. Smartwatches, fitness trackers, smart rings are now ubiquitous. Some of these devices qualify as medical devices, others do not, but they all hold valuable information that clinicians would love to include in their workflows. Yet it tends to remain stuck in apps, out of reach of teams who help improve patient outcomes. At the same time, there's a push for preventive care. Early detection and preventive care can reduce hospitalization cost. Getting information from the patient while outside of the hospital is key for this. Some of the concrete examples of data that could be collected this way are daily steps, calories burned for cardiac patients, spirometry for COPD patients, patient weight, distance, and calories burned for weight management programs, and much more. The market for EMRs is fragmented in Europe, and there is no pre-built way to access the data from either Apple Health or Android Health Connect. Apple Health has agreements with some EMRs for the US, UK, and Canadian markets, but not in other places. Solving this with custom-built integration is not scalable nor secure and has a high TCO. There is a demand for a more plug-and-play approach to this. This is where MyVitals, along with InterSystems healthcare experience, fits in. Let's see how MyVitals aims to solve this challenge. First, it's a server-side solution to receive the personal health device and medical device data from anywhere, and this we mean trusted counterparties, to process it and store it and send it to the EMR. It's also an optional mobile app that gets the data from Apple Health, Android Health Connect on the smartphones, and sends it securely to the server. The mobile app handles patient consent to access the data. We've detected early on two key requirements for MyVitals: ease of use and security. A critical step in this is patient enrollment, so we focused on seamless enrollment via QR code and secure transfers using OAuth 2. Additionally, the app installation, configuring, patient training, and patient enrollments are done at the hospital. On the hub side, MyVitals uses InterSystems FHIR server secured through OAuth 2, and it stores FHIR resources for observations, patient, devices, and more. On the back end, MyVitals includes a web app for patient and device administration, for data management and visualization. The interoperability with the EMR is handled through standard HL7 or custom connections, and we provide a set of standards APIs for enrollment and other patient or device management tasks as an alternative to a management app.
Now that we understand MyVitals' key features, let's have a look at how it works. First, the process starts with a doctor prescribing a personal device like a Fitbit to a patient. This triggers the patient registration process, generating a unique QR code for the patient. Patient scans this QR code and his account is activated. Second, once registered, the patient's connected devices stores data in Apple or Google Hub in the mobile phone. MyVitals mobile app then synchronizes this data, sending it to the MyVitals server. Third, after the data is received, it is processed and structured in a file repository. Some rules are then evaluated to detect issues and create alerts, enabling meaningful insights rather than just raw data. Here, hospitals can access this data directly from the FHIR repository or through custom integrations. On top of this, we also provide a MyVitals management web application where users can manage patients' registrations and connected devices and get insights from collected data. Let's talk about how MyVitals could scale and generate revenue. MyVitals could follow a software as a service subscription-based model, as it can be seen as a ready-to-use solution. Beyond the subscription, there are other value-added services that can be included, like connecting to customer-specific interfaces using HL7 sub-services, a mobile application for customers who don't have their own, and advanced insights. MyVitals is built on top of InterSystems technology, leveraging strengths in interoperability, FHIR repository, and FHIR SQL Builder. However, to bring the solution to market, we are adding two key components: an internal web application for managing patient data and visualizing insights, and a mobile app for customers without an existing one. And MyVitals can be flexible, so it can be deployed on premises or in the cloud, combining Health Connect Cloud and FHIR Server, or even building it as a part of InterSystems Data Fabric Studio for Health. All right, let's talk about potential customers. The first group of ideal customers are healthcare providers looking to integrate wearable health data into patient care. Many of them lack a streamlined way to bring this data into their workflows. Next, we have payers and insurance companies, where wearable data can play a major role in preventive care strategies and risk assessment. Other interesting segment is corporate wellness programs, where organizations investing in employee well-being may see MyVitals as an opportunity to track and improve employee health initiatives. Beyond these target segments, we have, of course, hospitals already using track care that could use MyVitals to extend their patient monitoring capabilities, integrating wearable data into their records. Additionally, customers using Iris for Health can easily adopt MyVitals to manage new types of patient-generated health data. That said, let's see MyVitals in action.
And now, let's walk through the patient enrollment process in MyVitals, demonstrating how a clinician can onboard a patient into the system. The clinician prescribes a connected device like a smartwatch to a patient. This device is paired with the patient's smartphone, in which MyVitals app will be installed and registered by scanning a QR code. Let's take a look at MyVitals management interface, where clinician can track and manage patient enrollments. As we log in, the recent activity dashboard shows new patient activation requests and health observations received in real time from different registered devices. Here, we can see a pending patient registration request. By selecting the request, the system displays a QR code, which can be used to finalize the verification and ensure secure device linking. This workflow ensures that patient onboarding is efficient, secure, and fully integrated into MyVitals ecosystem, bridging the gap between prescribed devices, real-time monitoring, and clinician oversight. Now, let's move to see how patients can send their data to MyVitals. The patient opens MyVitals app and navigates to the synchronization screen. From this section, all the health information available in Google Health Connect can be visualized, allowing to the patient to synchronize this data with MyVitals platform on demand, just clicking on Synchronization button, ensuring real-time updates for clinicians. Beyond passive data collection, MyVitals also delivers personalized tasks for the patient, such as tasks from care plans or synchronization reminders. All these tasks are managed through InterSystems Iris for Health workflow features. Let's see MyVitals web and how these data are managed. From recent activity dashboard screen, all new patient synchronized observations are accessible. At any moment, the user can review this information in detail from observations screen. Selecting any entry will show a detailed view of the patient's observation. MyVitals platform is not just about capturing data. It also detects potential health concerns from the issues screen. All flagged health anomalies are listed. These issues are automatically generated by the system and stored in the FHIR repository for clinician review. And finally, let's go over the key takeaways. First, wearable health data is underutilized, and MyVitals is designed to bridge that gap, bringing valuable patient-generated data into clinical workflows where it can truly make a difference. We know the market demand is strong. Healthcare providers, buyers, and corporate wellness programs are actively looking for solutions to integrate and leverage this type of data. From a business perspective, the revenue potential is solid. We have a subscription-based software-as-a-service model, plus multiple value-added services that create additional monetization opportunities. And we are not starting from scratch. MyVitals is built on proven InterSystems technology, leveraging our FHIR capabilities, interoperability framework, and security auth authentication to ensure seamless and scalable integration. Thank you very much for your time.